So now we are all in the corona season where we are maintaining social distancing. But even in corona times, in ventilated patients, we are allowed to give a fast, quick hug. So this is a mnemonic which you'll have to remember and you'll have to follow for each ventilated patient every single day. So the mnemonic stands for F is for fluid. So fluid therapy and feeding. So all ventilator patients, you'll have to keep a control of the fluid status. So usually ventilated patients do not require full maintenance fluid. Even 3/4, 75% maintenance fluid is enough for them because they're in an environment with lower temperature and their basal body requirement is much lesser and they may have SAADH. So their fluid requirement is 3/4 of the fluid is enough. On all ventilated patients, ensure you start feeding immediately. Once you put them on, intubate them, put them on ventilator, start it ASAP. The next point to remember is sedation is not equal to analgesia. A sedative will just make the patient sleep, but analgesic will take care of the pain. Intubated patient needs both sedative and analgesic. Suppose you give the patient midazolam, it has only a sedative action. It does not have an analgesic effect. So you may need to give a opioid like a fentanyl or morphine for the analgesic effect. So ensure all intubated patient gets a sedative and analgesic, and you will have to give sedation holiday each day. So each day in the morning shift, the nurse stops the sedation in the morning at 6 o'clock or 7 o'clock, sees the patient, how the patient behaves off sedation. And you decide on whether the patient is extubatable or not. In all patients, you ensure that thromboprophylaxis is required. This is more so for adults. For pediatric, especially in adolescent, they may need thromboprophylaxis. It can be in the form of stockings plus low molecular weight heparin. And this is a standard of care. All intubated patients should have head end elevation. So if you go into an ICU and you see a patient whose head end, ventilated patient whose head end is not elevated, that is not very good. That speaks bad about the ICU. So you ensure all patient has head end elevation 30 degree. And ulcer prophylaxis, this is probably not required these days unless the patient is very sick. You ensure good feeding and glucose control. Skin care is very, very important. You do frequent position change too early so that they don't develop any pressure sores. And you apply Chlorap eye ointment and you do ET suction. ET suctioning should not be taken lightly at all. ET suction, when you do it, it should be done in a sterile manner. It should be done with wearing sterile gloves. You use a separate suction catheter for the oral cavity and a separate suction catheter for the ET tube. You always do the oral suction first, followed by endotracheal suctioning. When you do the endotracheal suctioning, you'll have to know the length at which you'll have to go inside. You just can't go too deep and do suction. If you go too deep, you're likely to cause mucosal injury to the trachea. So you just ensure you measure the length of the ET tube and the suction catheter should be just 0.5 centimeter or 1 centimeter just below just more than the length of the ET tube. So you go in, do a suction. It should always be a rotatory motion when you go in, do the suction and just come out. The total duration of suctioning should be around 15 seconds maximum, max 20 seconds. So once you're done that, you look at the type of secretions. How is the secretion? How is the consistency? If it is purulent, you'll have to think of sending for culture sensitivity. So, and you'll set the suction pressure. Usually it is around 100 to 120. But for pediatric, sometimes you can go down to 80 to 100 also. So the suction pressure has to be set also. So always remember, ET suctioning can lead to sudden desaturation, bradycardia, and even cardiac arrest. So the ET suctioning should not be taken lightly. Then ensure that they have indwelling catheters, UCAT, NG tube for all patients, and bowel. So if they don't feed or something, they don't pass stools, ensure they have some suppository or fiber diet which has been placed. Environment nowadays is very, very important. So there is a concept of ICU delirium, which is seen in most of the patients, and you ensure that the environment is appropriate. You frequently stop sedation and see how they behave. You ensure just sunlight falls into the ICU so that they feel they're able to differentiate between what is day and what is night. Next point to remember is all intubated patients do not need antibiotics. The intubation may be for some other reason. It may not be for infection at all. maybe for just airway protection, for a trauma or something. So in that cases, there is no need for antibiotics. So only when there is needed, you give antibiotic, and you de-escalate when the based on the sensitivity pattern. And psychological support, counseling the attenders and family is very, very important. Nowadays, they even insist on doing video counseling for sick patients. So give your patient a fast hug in bed at least once a day.